another question. So what is the question we go through with this? So a 56-year-old woman comes to the physician for a physical examination required for health insurance. She has a history of ischemic heart disease. She states that she feels relatively well since her PCI 4 years ago. Since that time, she has stopped smoking, avoid eating red meat, food high saturated. Okay, she runs 3 miles on treadmill 3 times a week. That's good for her past 1 month. However, she has gotten severely short of breath even with 5 minutes of walk. Okay, she still smokes a lot, drinks 2 glasses of red wine. Physical examination shows a regular heart rate. That's good. Blood pressure is 145 over 95. Minimal crackles. A grade 2 by 6. Pansystolic murmur is audible. Best at the apex, radiating to the axilla. Now you will get what is it. So ECG shows Q wave in the inferior leads. Echo confirms your diagnosis. So the what is being asked is which of the following is the most appropriate initial step in the patient care. These are the most part of your step 2 CK questions that are being asked on the main day. The most appropriate initial step, or the what is the next best step. So these kinds of questions, they come a lot, and you need to do your best in these questions. Sometimes you know the diagnosis, but you couldn't, process your mind to find out the best next step. So look at the options. Left heart catheterization and coronary angiography, furosemide, and lateral and furosemide, mitral valve replacement, mitral valve repair. So you have few minutes. You can think about it and answer it. In the meanwhile, I will dissect it for you how to answer such questions. So patient has history of ischemic heart disease. Recently, she is complaining of having shortness of breath, and she's having now this systolic murmur heard at the apex, like the mitral area, and radiating towards the axilla. So most probably it is mitral regurgitation. So she is having minimal crackles at the bases. So maybe the heart is not pumping blood efficiently. So blood is backing up in the lungs. Also, it is showing Q waves. Maybe it is due to some chronic or previous MI, or sometimes when the heart is dilated, you see Q waves. So it is not that significant finding. And what is the best step? So we know the left heart catheterization and coronary angiography. At this stage, it is not required. So I will exclude this option. Furosemide, yes, possible, because patient has crackles at the bases, and she's having mitral regurgitation. Blood is pulling back. So yeah, furosemide could be the option. So I will just put a dot in front of it. Captopril and furosemide, possible, very much. Mitral valve replacement. I don't think so. We should go with the mitral valve replacement, as the primary etiology is not. It is not due to mitral valve regurgitation that things are happening, and the severity is, you can see minimal crackles, and it is only happening from since 1 month, and she has previous history of MI. So maybe due to the regurgitation is secondary due to cardiac changes or cardiac failure, maybe compensated cardiac failure. So mitral valve replacement is not the right answer. Same is the case with the mitral valve repair. I will, but so we have two options left: furosemide and captopril and furosemide. I think we will need both of them, because furosemide and captopril. I will go with these two, and we can also add beta blockers, because what they will do, furosemide will, um, let me write it down, decrease, furosemide will decrease your preload. You know what it does. It is also called, a urine pill. It drains a lot of water or fluid overload from your body, so less fluid goes, less blood goes to the heart, so less preload, so it decreases the pressures, and the captopril or enalapril, what it does, it decreases your afterload. So when you do this with the minimum symptoms, you will get better. So we can see what is the real thing. So yes, the correct option is C, and that was captopril and furosemide. So we can go through this, the correct option. Okay. So okay. So the patient has ischemic mitral valve regurgitation. Okay, as indicated by pansystolic murmur. Uh, we reached at that point that the murmur is mitral regurg. Okay, the disease is likely secondary to the systolic heart failure. This is the important point. Treatment is aimed at underlying heart failure, which may reduce the severity of the mitral regurg. So whenever you have you have the patient who comes with mitral regurgitation or any valvular heart disease, you need to look, is it a primary or is it secondary to heart changes or secondary to heart failure. If it is secondary to heart failure, then you have to treat that thing. So or you also know the patient is also not taking any drugs right now for heart failure. So the first most important thing is furosemide. Yeah, you can see it reduces the preload. This reduces the pulmonary venous hypertension, and an ACE inhibitor. It is very important. It also helps you to stop the cardiac remodeling after ischemic changes. Whenever you have a patient with an MI, so you give ACE inhibitor, as it is very high yield point that ACE inhibitor stops remodeling of heart or the changes that happens after ischemia with your with your endocardium or cardiac wall. So it you need to add the ACE inhibitors. It also reduces afterload. Okay, and increase the forward cardiac output. Additionally, a cardioselective beta blocker is indicated in all stages of systolic heart failure. So after medical therapy, say if the question, we can change the question a little bit. If we can say the patient, in spite of like this here, we can say not minimal crackles. We can say patient is feeling very shortness of breath. She couldn't even walk or to do her basic things like household chores or anything like that. Or there are crackles all around the lungs. X-ray shows congestion and patient is on oxygen. So she's already taking furosemide and captopril beta blockers. Then we can think about these valve replacement, but only after making the patient comfortable. Okay, so we can look into this. Okay, thank you.